Peace be to all. Assalamu Omar here. For those of you guys that don't know me, I am a family man, moderately fit, middle-aged endurance athlete, and a physician associate and doctor of health education by training. So, as a health educator, since that goes in conjunction, that's a heavy component of my medical work as a PA, I try to address health issues and acknowledge that certain months are associated or celebrated or acknowledged with diseases, if I said that right. So with every month there goes, we acknowledge or celebrate the acknowledgement of a particular condition. So this month is minority mental health awareness month, and that's a very important topic, especially in this day and age, because we're seeing a lot of harm done by people who are sick of mind and what I would say are sick of spirit and heart. So this is often manifested in some of the worst acts of violence, whether it's a drive-by shooting or a mass murder. A lot of times mental health comes into play as a part of the defense, when provided that the perpetrator of such violence is still alive and able to take the witness stand. But there are a lot of issues. There's issues of post-traumatic stress disorder with people who have grown up in a household where there's extreme violence, and they're subject to abuses, horrible, unspeakable abuses from the time they were little children. And I've had patients like this. I worked at an inner city clinic, actually a couple at this stage of my career, and I've had grown men in my office literally sobbing about what was done to them when they were boys. Molestation, horrible beatings, and then sometimes just abandonment. You guys see me in videos. I try to be with my children as much as possible, but just imagine being abandoned and saying, wow, the person who helped bring me into this world, my own dad, didn't even want to have anything to do with me. And that really messes with people's minds. As one brother put it, it made me feel some kind of way. So there's depression, and then people try to self-medicate with drugs, and even as drugs were put into the black community, like crack, heroin. I've treated a lot of heroin addicts over the years, and they get in conjunction with struggling with their disease, because drug addiction is part of the DSM-4 or DSM-5 rather, substance abuse. They're medicated on other things like methadone and Suboxone, or they transfer to crack, and then along with that, of course, goes unsafe sexual practices with sexual promiscuity to pay for the crack. Or if they're heroin addicts, they're sharing needles, so they get HIV, hepatitis C, and coincidentally, this is also HIV Stigma Awareness and Hepatitis C Stigma Awareness Month as well. So these are issues. It's fortuitous that those three diseases are being acknowledged in this same month. HIV stigma and hepatitis C stigma, and minorities and mental health awareness. But you can I've been able to do a lot of good, so my patients have told me, sometimes just listening. They've told me that somebody just listening to them, without judgment has really helped them. And I try to, the times where I've had jobs where I've had my own office, I've tried to create what I call safe spaces for my patients and just listen to them. So, before we judge people, you got to ask yourself, well, is this person's actions the end results of a lifetime of trauma? And it certainly doesn't excuse what they do. I think people should be held accountable for their actions, as much as the law allows. Because I know plenty of people who have been through horrific childhood trauma, everything, you can imagine. And they didn't kill anybody or rape or pillage or whatever a lot of these folks do. Hey, man, I want to go halfway up this hill. Okay. So with mental health, I encourage people to try to do things that can help with their mental health. I can get stressed out at my job. It's not easy dealing with other people's problems, and then you have to deal with your own life issues. But for me, I found that working out, and particularly in the woods, has been really, that's a great stress relief for me. It's better than any of these pharmaceuticals, street pharmaceuticals or, stuff that needs a prescription. There's wonderful oxygen out here. It's the various flora and fauna, but it's great. It's a great getaway from whatever's stressing you out. Man, look at us, we're sweating, we're not even muddy. We're just walking fast. And there's a cultural, I'll say this last thing, there's a cultural aspect of minorities and mental health. There's brothers who I know, black men, who I've tried to encourage to get help, with their anger issues or whatever they're dealing with. Brother, you want to talk to somebody? I can refer you to a therapist or a psychologist, somebody who's trained in this. Like, no, man, I ain't crazy. What you saying? I'm crazy? Well, I mean, no, I'm not. I'm not saying that because I don't want you to beat me up. But I'm suggesting that, what you've told me about your life and the issues with which you're dealing, you could benefit from talking to some type of mental health counselor. And they've been very beneficial to people. And it's a difference in culture. Now, I've had white women in my as patients of mine, and it's almost like a status symbol. Oh, I went to this therapist, and why would I take this pill? Oh, well, I take this pill. How does that work for you? And they have open conversations about what therapists they're seeing and what medications they're taking. Brothers, on the other hand, if you show any emotion for sadness, if you cry, you're considered soft. If you if you act out, man, he crazy, man. He crazy. If you talk about your problems, maybe your own fellow black man will be like, man, he's soft, man, he's whining. Remember when, for those of you guys that don't remember, there was a famous black actor who was sexually assaulted by a Hollywood producer, and when he was relaying it to the media, he broke out in tears. Now this guy is like 6'3", 240 pounds, and brothers were hard on him. They were like, "Oh man, he a punk, man. He's soft. If that guy had done it to me, that white boy had done it to me, he'd have been done. I'd have punched him in his face. I'd have done this." But then I looked deeper into that guy's past. He came from a horrible background. His dad used to beat his mother up in drunken rages, and he was saying that he didn't want to be that guy, and he was trying to hold his temper. His wife held him back from beating the dude up. But you know, brothers gave him grief about it and called him all sorts of names. I'm forgetting the guy's name, but you know, this is part of what we do to each other. We're not always forgiving. We're not always consoling to each other. So we got to do better as a community, us minorities. It's a hell. So that's it for now. If you want to be a PA and be part of the problem, or be part of the solution with helping people, minorities with their mental health issues, and you know, especially with HIV stigma and hepatitis stigma. I've had patients whose families members didn't even know they had HIV. I was the only one, so they confided in me. So feel free to contact me. I'll leave my email in the description. I wish you guys the best of success in your positive endeavors. Peace. Look at this hill. Look at this hill. Okay, we'll turn around back here. This is hard work. 20-pound weight vests and ankle weights in our hands.